Iberdomide is a new CELMoD or cereblon modifying agent, and this is a newer agent compared to the previous immunomodulatory agents, namely Thalidomide, Lenalidomide and Pomalidomide. The difference with Iberdomide is that Iberdomide binds to the cereblon binding site much tighter, which means that preclinically it's more effective than Lenalidomide and Pomalidomide. Importantly, it's a much more pure structure of a drug. What that essentially means is that you have one single isomer, and what we've found with thalidomide and the other analogues is that the mixture or the race mixtures cause the symptoms such as fatigue, constipation, poor cognitive function, which patients really find difficult. So in terms of Iberdomide, what we've found is that it's an effective treatment for multiple myeloma in a triple class exposed setting. The response rate is approximately 30%, which we think is significant in these difficult to treat patients. But I think what's really impressive about this is how well tolerated this drug is. When you look at the adverse event profile, the levels of neutropenia and thrombocytopenia are much lower compared to the other agents. The incidence of dose modifications is much lower, and we're seeing hardly any grade 3 and 4 events throughout. So overall, Iberdomide is, in my opinion, the best tolerated immunomodulatory or cereblon modifying drug that we have. And that lends itself very nicely both to moving it up earlier lines of treatment, because of course if you have a newly diagnosed patient, quality of life is very important for them. And so it lends itself for early lines of treatment, but it also lends itself for combinations with other drugs due to its low toxicity profile.